Section 5. External relationships and collaboration.
Meeting centres cannot exist in a vacuum. Having a place in and the support of the community surrounding them is important. They are more likely to thrive if the community around them is close-knit, active and dementia-friendly. Establishing a visible presence in their community also helps. With time and community networking, a meeting centre can play a role in creating a dementia proactive community around it. We have the following recommendations. We suggest meeting centres seek to engage other community groups and organisations, both when setting up and on an ongoing basis. Identifying and communicating with key people and visibly promoting the meeting centre at community events and forums can help with this. Try to link in with existing community activity to support people in need, particularly around dementia. Links can be forged with many areas of a local community. These include local businesses, charities and social enterprise groups, clubs, hobby groups, religious and cultural groups, councillors and other community leaders, police, fire and ambulance services and more. Links can be forged through inviting people in or going out to visit them, working together on small projects or putting on events together. This can boost promotion by word of mouth and ultimately help find new members, introduce new activities and even source funding. We have the following recommendations. We suggest meeting centres ensure someone has the responsibility and time to forge community links. First, they will need to find out about people, groups and organisations in the community that they could work with in some way. Next, invite these community members into the meeting centre or offer to go out to them to talk about it. Think of small projects or events that could involve people or groups from the community working together. If you attend a meeting centre, if you have links with groups, organisations or key people in the community, then talk to them about the meeting centre and what it does. This will help spread the word and get support. Strategic decisions made by the organisations that run meeting centres, such as how they structure themselves and how they work together, can have a major impact. Meeting centres can be run by grassroots groups in one town, village or local community, or by regional organisations, for example, working at county level, running multiple centres. Some have found it effective when these two types of organisation work together, as they can pool resources and bring different strengths. For example, a grassroots group may lack infrastructure and reach. A regional organisation may lack community knowledge and connections, but together they have everything covered. Organisations can be fiercely protective of what they do and wary of outside interference. They are also often put into competition when it comes to funding. This can lead to groups with similar goals being hesitant to work together. However, collaboration is vital to work effectively and efficiently in a sector with limited resources. Meeting centres are usually community-led, but larger charities or local authorities can get involved. A major benefit to this is better organisational infrastructure and resources with which to staff and run a centre. But larger organisations can struggle to make strong community connections. Larger organisations may have an agenda that varies from the original meeting centre model and may close a meeting centre if deemed not successful enough, or if the organisation's priorities change. We have the following recommendations. We suggest meeting centres avoid overlap and competition with others in the same sector. Instead, seek collaboration and ways in which your organisations can complement each other's work. Where there are organisations at a more local or more regional level that might provide something to help run the meeting centre, explore how you might work together. Where there is no such organisation at that level, consider if you might instigate setting up one. If possible, gathering evidence on what your meeting centre does can help it sustain. Having performance and cost data is essential to demonstrating its value to others in order to get support and funding. Being able to point to a robust evidence base for meeting centres can lend a meeting centre greater credibility and backing, as can getting involved with academic research. We have the following recommendations. We suggest meeting centres keep a record of basic data such as attendance, referral sources, joining and leaving dates, demographic data and income and expenditure. Regularly collect feedback from members and carers on what they think of the meeting centre and how it has impacted their lives. Consider engaging with academic institutions, researching meeting centres and what they do if the opportunity arises. You can also watch our videos on referrals and pathway, reaching people and membership, and finances and funding.
This independent research was funded by the National Institute for Health and Care Research, or NIHR, under its Research for Patient Benefit Research for Social Care programme. Grant reference number NIHR 201861. The views expressed are those of the authors and not necessarily those of the NIHR or the Department of Health and Social Care. We would like to acknowledge and thank all Meeting Centre attendees, personnel and partners that participated in this study, as well as our research collaborators at the Three Nations Working Group on Dementia, Nuffield Department of Primary Healthcare Sciences at the University of Oxford, London School of Economics and Political Science, and Worcestershire County Council.